Now. Or
And
now.
see,
Is it recording now?
yes, it is.
Okay. Okay.
Thank you.
I actually am gonna use this. I have a new app that is like, I'm gonna test it out on this meeting, okay?
Perfect.
Cause it supposedly does real time, like, different people talking, it tells, I
Oh,
don't know, taking notes and stuff, so we're gonna see.
love it.
Preparing to record, okay, there we go. All right, first, I noticed on your guys' calendar that you guys have a meeting with the Text My Gov
Mhm.
people coming up. They were trying to get a meeting with me, so could you just fill me in on what you learned after
Sure,
that
sure.
meeting? We have a text system that I pay for every year. It's, Text Me Now is what we use, and so that's what we've used, like, when we had, well, back actually into COVID. So we would use it for contact tracing, just to let people know you were exposed, like click on here. We used it during measles. So people could get that information without us having to physically make a phone call, and it just is a lot more efficient.
Sure.
We've used it for reminder calls for appointments and everything like that. So just let me know what you think of their program, and I can let you know what I pay for the other one. I can't, it's coming up. That way I don't have to take another meeting and you guys can just.
How much do you pay for yours then?
I don't know. I'll look and let you
Okay.
guys know.
Okay.
It's not very much. And they say you have to, continually buy credits, but we always have credits. So I think like you get more throughout the year as you use it. And I've never had to buy additional throughout a year. I
Sure.
just pay the year, the annual.
What's the credit thing about?
It's each text that goes out uses credits. So, and that's how they do it when you pay. So,
Oh, wow, you probably got lots of.
yeah, but I don't think it's very much. I will check on the price and let you guys know though. We had our Protect Your Herd coloring contest for our flu season. Again, this year we had 100 kids enter into that contest, so that's exciting. We had 89 last year, so 100 this year, so that's
Heck yeah.
great. It went really well. Bridget and I have our Pathways in-person meeting. It's tomorrow afternoon and then Thursday morning. So we'll travel tomorrow morning, and then travel back Thursday afternoon. It's in Shodo.
Okay.
Trying to make it in smaller areas, because the people taking part in Pathways are from all over, like the eastern part, western part. So
Sure.
the last one I think was in White Sulphur.
Oh, wow.
This one's in Shodo.
Doing all the big metropolitan areas.
Yes, I've never been to Shodo, I don't think.
Cool town.
Yeah.
Really
so-
cool town.
So we're gonna go to that tomorrow. Laura finished up her micro course,
Yay.
passed it with flying colors. So now she's just studying and gonna schedule her RS exam.
Cool. So once she gets fully licensed,
Mhm.
we'll probably have to do a raise letter for that then.
Yes, yep.
Okay, we'll be looking for that. Is Sarah just kind of gonna phase out then, or is she gonna still kind of?
She would be happy to stay on.
Okay.
I talked with her, that I would love to have her on the books
Yeah.
as she is now, because we only pay her when she's up
Yeah.
and working.
Yeah.
And she was very happy with that.
Okay.
Sounds of it, so.
I love it.
Well, it's nice having that backup.
It is, yeah, because things happen. So, yeah, and people take vacation, right?
Yeah,
So.
yeah.
For our HPAI funding, which is the highly pathogenic avian influenza funding that we got, that has to be sent by the 15th of this month. I'll let you know some of what we are doing with it. We are making coop cleanup kits for people with chickens. So, this is an example of it. So
Cool.
what we have in here is gloves, a scrub brush, a safety mask, some information on this sheet on how to safely clean your coop, and keep yourself safe. And then we had stickers created that say treat poultry like produce, wash up, and look at it's a little chicken with boots on it.
Nice. Nice.
So you guys can look at that. We're doing that. We're gonna push that out probably more in the spring, like around probably, Easter time when people are getting all their baby chicks.
That's awesome.
For people to just learn how to safely clean that up.
I think my daughter does that too, and it's
Oh,
be nice for her to have, because little kids are around.
Mm-hmm. Yeah.
They help.
So we're doing that. We have contacted local veterinarians to see if there's any trainings that they are wanting to go to. This is around highly pathogenic avian influenza. The Bear Paw vet has gotten back to us, and I believe they have one training, and we're gonna pay for that registration and travel for them to get there. And then we're also gonna bring in a local HPAI educational meeting tabletop exercise for our county.
I apologize, HPA.
Highly pathogenic avian influenza.
Okay, thank you.
Um, and then also, we're looking into purchasing the COVID and influenza at-home test kits to have at the health department for people to come grab. Because we've had a few people come in and ask. They're used to us having the free at-home COVID tests. So we're looking at purchasing some of those and having them available
Nice.
as well.
Cool.
Yes.
We do like a celebration for Laura, like when she gets licensed.
yeah.
Like have
Yeah.
cake or something over at the health
Yeah,
department.
definitely.
I think that'd be kind of cool.
Yeah, that'd be great. Definitely, yeah, definitely do that. Any questions on the HPAI stuff?
No, I think it's definitely awesome that you guys are doing that. And
And that funding is, it's HPAI funding. However, what the state wants us to focus on is respiratory illnesses. All encompassing, not just highly pathogenic avian influenza. So when Bridget put together this, information on this card in here, she worked with a veterinarian from the state, and we had HPAI information in here on how to prevent it, and they wanted all of that taken out. They wanted it just very generic because our local flocks are a very low risk for HPAI. And our county is still considered a low risk, even though we have wild birds that fly over. They're still considering our area a low risk for this. So they just wanted us to focus kind of more broadly on just health of your chickens, health of yourself, and proper handling of your poultry.
sure.
We did that. And now I have some graphs for you to look at. So we monitor our wastewater for RSV, COVID-19, influenza A and B, measles. I believe that is it. So this here graph, it gets a little busy, and don't strain your eyes too much because I'm gonna pull the two out that I'm gonna talk about. I'll show you influenza A and B. We are currently not seeing any influenza B in our wastewater and in our communities. Influenza A is starting to spike right now, and you'll see that right at the end of this graph, right here. The very left side is about last year. So spiking a little earlier than last year, for influenza. And influenza B, we don't have any circulating at this point based off of wastewater.
Sure.
COVID is seeing a really large increase in the last week, which is spiking about probably 2 weeks. 2 weeks or more earlier than last year. So, we're gonna be putting out some information about signs and symptoms to be watching for, typical information that we have. To go along with this, though, it's like, so right now I have 13 active cases of COVID that have been reported.
Okay.
So
And reported again, it's through
reported means they went in and were tested.
by a health professional.
Yes. Yep, not home tests.
Sure.
So when I have those cases and I report those cases, it truly isn't giving the larger picture that we have quite a bit of COVID. And so getting that message out is what we're gonna do today on Facebook. It's got this information today from Carroll
It's so
College.
hard because the symptoms are so close to it.
Oh, yes.
Annika's home today.
Yep.
And she was just pale, but she had like the headache, her stomach's upset. I feel good.
Well, and there's a lot of
When
things going around. There's COVID, there's flu, there's parainfluenza, there's enterovirus. I mean, which is just,
I've heard the rhino.
yeah, and rhinovirus. There's a lot of viruses just going around right now, and it will see an increase after the holidays because we all got together. Um, and so, yeah.
Now, for this, to get this data,
Mhm.
this is you do wastewater collection
Yes,
from the city?
from the
or-
city. Yep.
And then that is when it's sent to Helena, to Carroll?
Yep, to Carroll College.
So what's the time from the time you collect it to the time that they get it, and it comes back to you and you get the data? What's the time?
It's about a week. So they send it every Monday and Wednesday. So there's two samples that the city of Havre sends to Carroll College, and we get results every week. So it's usually,
Oh, it's within a week?
Yep.
Okay.
yeah. So it's really good data to see. We have no measles in our wastewater. We have no RSV, and we have no influenza B at this point. So that's all a plus. I believe we may have some RSV. The people that are hit most with RSV are young infants. And they wouldn't be in our wastewater system.
Sure.
To go along with this, I don't have much information about it, but I know that the CDC is working to change the vaccination schedule.
Yeah, I was gonna ask about that. when it came up.
I haven't gotten any information from the state, and I need to have a conversation with our medical director with some of the changes. Sure. Pushing. So, and then as soon as I have more info on what it truly means for my department and what we are going to offer,
Those
what
are
we
some-
can offer.
Potentially some radical
Yeah.
changes.
Well, it all is pretty radical when you go against science. So that's the part that's hard for me in public health. You have to follow science. You have to have science-based and science-backed information. And this does not follow science. So I just and what he wants for our standing orders. The American Academy of Pediatrics has followed their own schedule now. They are not following the CDC and ACIP recommendations because they don't believe it follows science and that it will harm people. So they have their own schedule, which is the recommended schedule that we've been following up until now that the CDC is changing it. So I just have to get Dr. Mark's point of view on that. We are under his license for those vaccinations. And he signs those standing
And who's
orders.
this, Dr. Mark?
Dr. Mark down in Hard.
Okay.
Yeah, big compliment.
Yes, thank you. I was like, what?
Okay.
Where is he? Yeah. So, and I'll let you know more on that.
Cool, thank you.
And so far, so I keep track of COVID-19 cases in a calendar year. For January through December of 2025, we had 163 total COVID cases that were reported,
Wow.
which is less than the 163.
What dates again?
Oh, January 1st through December.
Are you talking about last year? Okay.
Yeah, so flu is different because the flu season is like October 1 through like March or April. That's how flu season runs. And so COVID, we just keep track of the calendar year. So we had 163.
Those are reported, of
Yes.
course.
And so far this flu season, we've had 33 flu cases reported. I was looking at my budgets. All of my budgets are on track. My grants are looking good. And I've spent about 25% of my county money.
Wow.
I spend the grants first.
Trying to think. Job openings,
I have a lead prevention specialist.
Yeah.
Bill, but it's a hard one to fill.
it is, yeah, it is.
And that funding is only through September of this year with unknown.
Sure. Yeah. Okay,
But otherwise, we're overstaffed.
looks good. You still got, Jordan coming up next week.
Yeah, she's up next Tuesday.
Oh, nice, nice.
Sent out the Board of Health meeting minutes draft, if you guys have any changes or whatever. I try to do the best I can.
I wasn't there,
Oh, that's
but
right.
I did get them.
Yeah, and then I think we're looking to maybe change that.
Yeah, it looked like the fourth, February
I'm
fourth.
thinking I need to respond back.
Oh, yeah, so you got Mako the next week. 15th,
Oh,
I think.
yeah.
Think, yeah, Mako starts on the 15th, so that goes through the,
Does it
19th?
start on a Sunday? Well, sometimes they do now. I don't know where they're kind of changing things up a little bit.
I think it's in Billings this year.
Starting to do like Sundays, you come in on a Sunday and then you go home on a
Wednesday or Thursday.
Yeah. Starting to change it up.
I like it when they allow travel time in the morning
Right.
and then in the afternoon. That's nice. It's easy. Any questions or anything?
How's everybody doing over there?
Okay.
Good.
Good. Oh, I was gonna touch with the delivering meals. If there could be a plan given to Laura, or even just a conversation with Laura on how those are gonna be delivered at the highway.
Sure.
Basically, the process of keeping them.
Right now, we have to order more containers. So I was actually gonna sit down today and start coming out late in the list.
Okay, if you have
Now that things
questions,
have calmed down a little bit more.
Yeah, we kind of thought
Feel-
that they'd ordered more than
Well,
they did.
how many? did
They ordered 6, but we need 6 more. Or no, they ordered 2, but we need 6. I
For
don't know.
here,
Double check.
I think, wasn't it? Or,
They ordered nothing for the highway,
yeah,
like we were told. Yeah, I'm literally gonna have to start from scratch down there,
Okay,
because I have
well-
to get a contract in place, talk to Joy here.
Well, if you
We
need
need something
help,
solid.
reach out to
We
me
have
and
somebody-
Laura.
wants to be admitted
Pardon me?
in our
Somebody wants to. be admitted.
unverified, yeah. It's not casting.
I'm gonna start doing that now. Smiley face.
Smiley face on your phone.
It won't do it.
Well,
That,
smiley
like, you
face.
want me to get with Laura?
Yeah, she'd be happy to help. She just wants to make sure that temperatures are good.
Absolutely.
So,
No,
Well, when we found out that those containers held it,
yeah,
I-
they will-
I think we were all under the impression, okay, we're gonna go forward and purchase more of those.
those containers.
And yeah, they need another heating,
Oh, like a heating
Thing,
internal
yeah.
thing.
I wanna call it a kind of element. They need another one for here. So I need to sit down and, see how much it's all gonna cost, get approval. And do our budget sitting. Just,
Sounds good.
Cool.
All right.
Can't think of anything that I have. Yep. No, thank you for all you do and your staff.
You're welcome.
Appreciate you guys.
Meeting's over.
Meeting's over.
And, oh, no, thank you for this information. I love graphs and charts.
Yeah.